Okay, so today we're going to talk about, in this video, history taking and how to change a patient. I don't go through it in every positioning video just because it's time consuming. So the videos typically focus on positioning, but just so that you have an understanding of that. Ideally, when you get a patient from the emergency room or from the floor, you already know where that patient is, and you are pretty positive that that patient that's in the space they say is that patient. So confirming is done, but it's not as important as if you get the patient out of the waiting room, like if it's an outpatient. So in this scenario, we're just going to pretend that Mariah is an outpatient. And what we would do with that, we would have a requisition, so we would know what we were going to order, we would know who the patient was, and we would have the identifying information that we can confirm she is who she says she is. So I would come out and I would introduce myself, and I would call her. So Miss Hutchinson?
Yes.
Hi, I'm Lisa. I'm going to be your tech today.
Okay.
Can I go ahead and confirm your last name and date of birth for me?
Hutchinson, Hutchinson.
And your date of birth?
August 14th, 2002.
Okay. All right. And can I just check your wristband there?
Yes.
Good. So we want to check that. And with her telling me and verbally confirming her date of birth, then I know that is who my patient is. So that's typically the first thing you want to do. And doing that in front of people, I'd probably just lower my voice a little, but that's the first thing. At this point, if I was going to change my patient, that would be what I would do first. There's a couple things. If it's a female patient, I want to confirm that there's no chance of pregnancy prior to changing them, because if I ask that after the fact and there was a chance, then I'm going to have to let her get dressed and go through all of that again. So it's best to confirm that in the beginning, make sure that that's not the case, and then allow the patient to change. So what I would say to her, either quietly, or I would bring her with me to an area where other people, if there's nobody else around, it's okay. If there's a lot of people, I would not ask in front, but I would say, so before we do your exam today, is there any chance at all that you could be pregnant?
No.
Okay. When was your last menstrual period?
A week ago.
A week ago. And so I'm going to record this information. She's telling me her last menstrual cycle was 1 week ago. Now, because it's less than 10 days, typically the 10-day rule says that if a menstrual cycle is within 10 days of the x-ray, the chances of her ovulating are not likely. So with that, I feel like it would be okay to move forward with her exam. If she answered me and the answer was 10 days or beyond, I would want to follow with questions like, has she had any unprotected sex since her last menstrual cycle? And if so, is she sure that there's not a chance that she could be pregnant? If she was unsure, depending on protocol, sometimes you're allowed to send them to the lab to get testing. Sometimes you might have to send them back to their ordering physician and confirm those results before you do the exam. So I'm not saying we can't x-ray someone if they're pregnant. You just need to be aware of that. And if it's an exam that is not necessary or vital right at that time, what we could tell the patient is, since there is a chance and you're not sure, and this injury was, not a recent traumatic injury, we could tell her to come back when she does get her menstrual cycle, and then we would be able to do those x-rays. So, assuming we've established that she's not pregnant, and if I have to change her, you kind of have to think about, what am I imaging? Wherever you're imaging in the body, you need to remove the clothing and any artifacts from that area. So if she was for a chest x-ray, I would need everything off from her waist up. That would include top, bra, any jewelry, any piercings, necklace, anything that would obscure anatomy from basically her chin down to her waist. If she was something lower, like abdomen or hip or pelvis, I would want everything off. Typically bra, because you never really know how low that will image on there. So top, bra, pants. Underwear typically can stay on unless there's any kind of adornments on them. They need to be removed. If there weren't, she could leave those on, and then the gown again would go on open to the back. Most gowns are one size fits all. If your patient does not appear or does not either seem comfortable, or it doesn't seem like the one gown would fit open to the back, I would put one open to the back and give the patient a second gown to put on like a coat. That way they feel covered. You don't want them to feel exposed or embarrassed to come out of the dressing room and into the room. So for today's exam, Mariah is going to be a hand, so we don't need to change her for that. So I'm going to let you follow me into the room, and we're going to talk about history. So I'm going to let you just have a seat there for me if you would.
Okay.
All right, so I see that we have an order here for your hand. What's going on? Why did they order that?
Well, I hit it with a hammer
Okay,
a couple days ago.
okay. Where exactly? 2 days ago?
Yeah.
Okay. And where did you hit that?
Closer towards my fingers.
Okay, it is a little red and bruised right there. So when I'm asking history, sorry, it's hard to it's hard to think and write at the same time. When you're asking history, ultimately you want to know what happened, when did it happen, and where's affected. There are the sacred 7 elements of history taking, and I'm not saying that we don't pay attention to that, but I'm saying usually if you cover what, when, and where, you kind of get all the details. So when I asked her, you start with a generic question like, what brings you in, or why did your doctor order this, or what's going on that we're doing these images, and then allow the patient to tell you as much as they will, and then you kind of ask more probing questions. So she told me she hit it with a hammer 2 days ago, so I have the what, I have the when, and the where would be asking her to localize where is that, and then when she pointed, that would be between the 2nd and 3rd metacarpal phalangeal area is where she pointed, so that's what I would write. I said that it was bruised and appeared red between the 2nd and 3rd digits, specifically MCP. You want to know anything that you see because that would be considered objective information, and anything like if I say to her subjectively would be, so did that hurt when you did it? I'm assuming it did.
Yes.
Is it still bothering you?
Yeah, when I bend my hand.
Okay. If you, on a pain scale from 0 being no pain, 10 being the worst pain ever, what would you rate that?
About a 6.
Okay. All right. And I notice your opening and closing, are you limited in one direction versus the other?
Not that I've noticed.
Okay. All right. And which hand is dominant for you? Are you right-handed? Okay. All right. So she's a 6 out of 10. It would be important to know that she's right-handed because she uses that more prominently and dominantly, so that's worth noting. Typically you just want to be nosy. You want to be inquisitive and find out all the details of what went on. Something like an extremity is a little bit easier. If it's trunk work, then you want to add in specific questions, and we'll talk about that as we go, but like if it's a chest x-ray, you always want to know on the trunk if they've had any surgery to that area. If it's specifically a chest, you ask them if they're a smoker. If they do smoke, you need to know how many cigarettes do they smoke, or is it cigarettes that they smoke? If it's something else, then you can note that as well. We're not trying to find out information to pass along to law enforcement. We're simply trying to find out information for the radiologist, because the entire point of a history, it's often overlooked by technologists, but it's vital. Because that radiologist, when they get those images and they get the history that you're writing or transcribing, it helps them look at that image and know what happened, and therefore why does the image look like that. So you really are their eyes and ears, and then you provide that picture which gives an inside view of what's going on. So it's a vital component. It's something that technologists, I think, take too lightly, but it's definitely something that needs to be done appropriately in order to assist the radiologist, because every time they read those images, they're literally putting their license on the line and opening themselves up to lawsuit if we're not providing the most information that we possibly can. So specific to what you're imaging, there might be additional questions that you ask, but ultimately you're trying to capture what happened, when did it happen, and from that, what is going on? What pain do you have? Noting any discolorations or swelling. Basically just trying to find out from the patient what exactly happened. If it's a fall, what direction did they fall would play a part. And it's just a good way to have the patient have a little bit of confidence in you and recognize that, you know, you're trying to do the best that you can. Sometimes patients get aggravated with us asking, but we try and tell them that that's going forward to the radiologist and that we understand they've told that before, but we're just trying to gather information for them. So I think I've got it. Menstrual period 1 week ago. You hit it with a hammer 2 days ago.
Mm-hmm.
It is bruised, red, slight swelling between the second and third metacarpal phalangeal joint. Your pain level is a 6 out of 10, and you are right hand dominant.
Mm-hmm.
Anything else you can think that you'd like me to add for the radiologist with that?
Not that I can think of.
Probably that you won't be constructing anything anytime soon.
No.
And then once you conclude your history, you would start the exam. And you also can take history while you're doing the exam. It's just whatever you're comfortable with. I feel like as you go, you can start to ask the questions as you're doing the imaging. And sometimes that's time saving as well. But other than changing the patient and history taking, I got nothing else.